On behalf of the Banting Research Foundation, I'm delighted to welcome you to our virtual event focused on one of the important aspects of climate change, namely the urgent health challenges that we all face. The Banting Research Foundation Administrative Hub is in Toronto, and I wish to acknowledge this land on which we operate. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And today, this meeting place is still the home of many Indigenous peoples from across Turtle Island. And we're grateful to have this opportunity to work on the land that we recognize today. And I know those of you joining from across Canada gratefully acknowledge the land on which you live and work. Our nonprofit organization is approaching 100 years of supporting early career researchers in Canada who are leading discovery in health and biomedical sciences. And we provide them with seed funding to investigate their bold ideas, similar to the support Frederick Banting received on his quest to discover insulin. Today, you will meet many of our Banting Discovery awardees who will tell you about their exciting research programs that are addressing major health challenges. And we're thrilled to welcome a number of them who will participate in the panel discussion and who will be introduced shortly. Thanks so much to you, Ivan, for agreeing to moderate our panel. You're well known to many of us about, and we truly enjoy your stellar science journalism. And to you, Daniel, for your work today emceeing our event. Today's event was organized by our amazing executive director, Maureen Kwok. Thanks so much, Maureen. The Banting Research Foundation aspires to expand its efforts in support of Canada's early career investigators. And we're increasing the amount and number of our awards through generous donations and, importantly, strategic partnering. Last year, we established a partnership with Mitacs, and I'm very pleased to welcome and introduce John Hepburn, the CEO and scientific director of Mitacs, who will join our panel today and also has an exciting announcement about a new joint program. Over to you, John.
Thanks very much, Kathy, and it's a pleasure to be here. I think outside of a few horn honkers in Ottawa, all of us realize that the climate crisis is upon us. It's not something that's going to happen in the future. It will impact and is impacting billions of people globally, and especially, not especially, but it's having an impact on all of us in Canada. I'm here in the unceded traditional territories of Musqueam, Tsleil-Waututh, and Squamish people, along with Kate, I believe. And we're kind of climate change central this year. We've had, it's like biblical plagues, and I shouldn't joke about it. We had a heat dome in June that killed over 600 people. There's a health impact. We've had fires that destroyed towns and also had a huge impact on First Nations communities in the interior of BC. And of course, then we had floods in the fall, which wiped out transportation corridors. We were cut off from the rest of Canada for a while, for those of you who worry about BC being cut off. This all is in 1 year. And so if you need further proof that climate change is real, just come visit us. However, climate change affects, as the heat dome proved, climate change has a huge impact on health. And so we need, and particularly for marginalized people, and so we need to look for solutions. Solutions are going to come from collaboration, from partnerships. Mitacs is an large national organization that promotes partnerships. And so we're thrilled to have a partnership now with the Banting Foundation to support the sort of work that we need, that we're going to hear about actually. And this program, this joint program with the Banting Foundation, is to support Mitacs Banting Discovery Postdoctoral Fellowships. So all these wonderful Discovery Award winners that we're going to hear from today, they will have access to postdoctoral fellowships. It's a 2-year fellowship program, and that will support the great research that they're doing in health science. The partnership model that we use at Mitacs, of course, is all about promoting partnerships between academia, academic researchers, and the external community, industry, not-for-profits. And so that's what these fellowships will support. in our recently published strategic plan, of course, one of our key pillars was deploying bright minds for a better future. And the bright minds are not only the Discovery Award winners, the Discovery Fellowship winners, but these new postdoctoral fellowships. Programs like this partnership help young researchers build professional interdisciplinary skills that they will need for future success outside academia, but also inside academia. The other thing is that MyTax spans all disciplines. And as we know, we're not going to solve the climate crisis without an interdisciplinary approach, both to health research and also general research into mitigating and coping with climate change. And so that's what this is supporting. Now, I'm looking forward to hearing from the Discovery Award winners today, and I'm looking forward to seeing what the outcomes of this partnership with Banting will do. So thank you very much, Kathy, and thank you, Ivan, for asking the questions you're about to ask us.
Thanks so much for that, Kathy and John. I love that phraseology, bright minds for a better future. And there certainly are some bright minds here today to ensure that better future, which is really exciting. Everyone's really excited about what the future holds for this important partnership. I'm also excited to get the main event going here, which is our panel on health and climate change. Just before I introduce the panelists, 2 quick notes. If you're sharing anything about the event on social media, suggest using the hashtag Discovery2022. And if you have questions for the panel, please drop them in the chat. And I know that Ivan will coordinate with our panelists and ensure that some of those questions do get answered. So without further ado, our moderator today is Ivan Semeniuk, who, as many of you know, is a science reporter at the Globe and Mail. And his beat ranges from the furthest reaches of the cosmos, we talked a little bit about that before today, to the most pressing issues and discoveries related to the environment, technology, and human health. So we could really think of no one better to moderate this panel. And just a quick plug, if you aren't a Globe subscriber, why not? Today's a great day to subscribe. So on our panel today, we have John Hepburn, who, as you know, is the CEO of MyTax, and his academic expertise really lies in chemistry and physics. We also have Dr. Stephen Shearer, who is one of Canada's most acclaimed scientists making contributions towards the understanding of the human genome. And he is currently Chief of Research at the Hospital for Sick Children. We also have Dr. Nomazulu Dilamini, who is the Director of the Children's Stroke Program at the Hospital for Sick Children. And she provides international leadership through a number of organizations focused on children's stroke. So she's not just a star in Canada, but a star abroad as well. We have with us Dr. Kate Weinberger, who's an assistant professor at the School of Population and Public Health at UBC. There, she is an environmental epidemiologist with a background in climate science and environmental health. And her research focuses on the links between climate change and human health. We have with us Dr. Gareth Lim, who is an associate professor at the Université de Montréal and a Canada Research Chair holder. Dr. Lim and his team have been researching how certain proteins affect the development of obesity. And this research may lead to new approaches to promote long-term weight loss and prevent the prevalence of diabetes. We also have Dr. Jeremy Hirota, who is an assistant professor in the Department of Medicine at McMaster University. His research focuses on respiratory mucosal immunology in airway diseases. And Jeremy brings some really unique perspectives because he's the founder of a company as well. So he's thinking a lot about the intersections between research and commercialization. So without further ado, Ivan, I'll let you take it away.
Great, thank you so much, Daniel. Really appreciate that. It's a pleasure to be with all of you today to participate and moderate, especially with such an interesting expert panel. I'm here to ask some questions, as John said, but really also perhaps more importantly to facilitate your questions. So definitely as you hear the panelists, please think about what you want to drop in the chat and throw those questions in there. We'll make room for as many of them as we can. As Daniel said, I'm Ivan Semeniuk. I report on science for the Globe and Mail. And today's panel really lies at the intersection of 2 big domains where I have been spending a lot of my working time especially over the past few years, and of course those domains being climate change and human health. It would be hard to overstate how timely this panel is. It's coming just 4 weeks out from the latest report from the second working group of the 6th assessment of the United Nations Intergovernmental Panel on Climate Change, the IPCC. And just to kind of bring everyone up to speed, you may recall, if you've followed the news, Working Group 1 of the IPCC released their report, their latest report on the physical basis of climate change last August. And that was much of that informed international talks in Glasgow in November. Among the headlines from that release, humans are unequivocally the main cause of climate change. That's a reality that's kind of effectively now beyond constructive scientific debate. The effect on our atmosphere and weather are already apparent, and they're becoming more so because tools for measuring and attributing climate change are improving, and also the signal that's being measured is growing stronger by the year. That's Working Group 1. Working Group 2 has a different focus. It's been 7 years since we've heard from this thrust of what the IPCC does. What they do is they bring together and reflect the current state of knowledge on the impacts of climate change. In the past, reports from Working Group 2 have focused on processes like sea level rise, loss of permafrost, stress on temperature-sensitive ecosystems like coral reefs and so on. Every indication is that the latest version of this report, which is due out on February 28th, will include all of those things, but also, probably more than we've seen in the past, it will also look at human health, particularly in urban areas where the largest share now of the world's population lives. So we know that health is one of the ways in which climate change is manifesting itself around the world. And that brings us to today's panel. It's made up of experts across the spectrum of biomedical research in Canada, and just the diversity of this panel alone tells you that we're really no longer in the era where climate change kind of fits into a neat box as, an environmental issue. Much like COVID has been, climate change is pervasive, and it's a looming driver of change across all sectors of life, including health and medicine. So that brings me to my first question for the panel, and I'll put this to everyone in the panel in order. I'm sort of roughly going to follow, kind of going from public health, maybe into what we might loosely call chronic disease, and then into drivers of disease, and maybe the research agenda will sort of go that way. So I'll start with Kate, but the question I'll have for everyone is, how has climate change inserted itself into your work? Maybe how you think about your work, and also how you plan for your future of the work you do, the research you do. So how is climate change already part of that? So Kate, I guess for you, it won't be hard to answer that. It's but maybe you can kind of help kind of put some boundaries around it.
Yeah, thank you so much for the question, Ivan. I am unmuted, right? Yes. Okay. Yeah, thank you for the question, and thanks to the organizers for inviting me to be part of the event today. I do think that I perhaps have the easiest job here. So as Daniel was mentioning, I'm an epidemiologist by training, an environmental epidemiologist, and climate change is actually the central subject of my program of research, specifically the human health impacts of climate change, the subject of this panel today. And so I think as we'll probably hear from some of my co-panelists today, climate change is expected to impact health through all sorts of different pathways, right? It's not a simple issue. But a particular focus of my research these days is on one of the most direct pathways. And that's the pathway related to extreme heat, right? So as temperatures continue to rise in the decades to come, we expect to see more frequent and more severe heat waves with pretty substantial potential impacts on human health. And so I was going to bring up an example, and actually Dawn Hepburn referenced this before, because I think those of us who live in BC, it's been top of mind, but I think You know, as you've just heard, just this past summer, we experienced a heat wave really of unprecedented proportions for this part of the world. So you may have heard, for example, there's a town called Lytton that actually broke the record for the hottest temperature ever recorded in Canada this summer, which I believe was just over 49 degrees Celsius. And even Vancouver, which is where I currently am, we had temperatures well into the 30s for days in a row. And keep in mind that this isn't a place where, you know, by and large, people don't have access to air conditioned or otherwise cooled spaces. You know, and beyond sort of the record-setting temperatures, I think this heat wave was a really dramatic example of what a warming world could mean for our health. In BC, we saw hundreds of excess deaths, and it's likely that we'll find out that there were many more episodes of non-fatal illnesses attributable to the heat dome as well. You know, so in the face of events like this, to me, a really critical question is, you know, how do we prepare, right? If we're already seeing impacts like this, we need to be prepared for a warming world. And as a researcher, you know, one of the things I think we need to know is you know, what's the full extent of the impact? Who is affected? And in what ways are people going to be affected? How do we sort of get towards a full accounting of the health impacts of events like the one that we saw this summer in BC? And so a large part of my work is focused on trying to understand that full range of health impacts associated with heat. This means that I do a fair amount of work trying to characterize the impacts of heat in populations that have received less attention to date in sort of the literature looking at heat health impacts. So one of those populations is children. I also increasingly have been doing some work thinking about outdoor temperatures and heat exposure in workplace settings. And another piece of that is looking at sort of the full range of health outcomes. So we know that heat can contribute directly to heat-related illnesses like heat stroke. But we also believe that it can contribute to the exacerbation of other chronic conditions as well. So I think, I feel like I've been talking for a while, so I hope that gives you a general sense of sort of how climate change factors into my work. I think I'll just close by emphasizing, you know, again, that heat waves are just really the tip of the iceberg here. We believe that climate change will affect health in all sorts of other ways, whether that's through extreme storms, through wildfires, which we also saw this past summer in BC, whether it's through sort of changing patterns of allergens or vector-borne diseases, through food quality and availability, or even through population displacement. And so I'm really looking forward to hearing from my colleagues and hearing how some of this factors into their work.
Kate, that was terrific. What a menu of things to think about. As you say, starting off with some of the most direct impacts, and probably going from that, it makes sense to go now to Jeremy. I'm going to speak to Jeremy and then Gareth. Really, kind of looking at, you know, both sort of in the respiratory domain when we start thinking about temperatures going up, cities becoming intolerable. What does that mean for your work, Jeremy?
Yeah, Ivan, thanks for that question. We can hear me? Yes, off mute, perfect. And Kate, thanks for the setup. I mean, I think actually what we need is 10 more Kates or maybe 100 more Kates to kind of get to the bottom of a lot of these problems. I mean, really the problems that we tackle in our group is understanding the air we breathe and how it impacts lung health and disease. We haven't really looked at temperature directly, to say the temperature of the air, how that impacts lung health and disease. But the consequences of those changes of temperature being what Kate was hinting at, wildfires and increasing biomass combustion and the use of biomass, and how this can be impacting people really in all ages, all demographics can be exposed. There's no one that's protected from this. So sort of, I know there is this issue that some people may be more at risk, and there are populations that may be understudied, or but in our case, everybody needs to breathe the air, and this impacts everybody. So for us, wildfires and air pollution sort of are the dominant ways that climate change kind of features into the research that we do. we are interested in this in the context of healthy people. Maybe there's people on this call that don't have a chronic respiratory disease. We're interested in how that poor air quality or reduced air quality could impact those healthy people and maybe the development of a disease with them. Or we're also interested in how that air quality may impact the exacerbations or flare-ups of individuals that have an underlying chronic respiratory disease. And really, we don't necessarily think about air pollution or air quality in isolation either. And I think Kate mentioned, changing in aeroallergen patterns, so allergens that might be inhaled. Here in Southern Ontario, Jesus, last spring and early summer, there are crazy tree pollens that were out of the records. And I know personally, I suffered from that. I had flare-ups of my asthma. And these are interacting. These things, the weather changes are interacting with the aeroallergens, which are interacting with the air quality in the terms of smog and air pollution and particulate matter exposure. So we're trying to not necessarily look at those in isolation. It does make for messy models because you're adding multiple ingredients and you're trying to tease out cause and effect. But really, I don't think if we don't try to look at things together, then we're just going to be getting little pieces. And really, sometimes 1 + 1 is turning out to be 4 or 5 in some of the work we do. So at that point, Ivan, I'll hand it back over to you.
Great, thank you very much for that, Jeremy. I think lots of questions to pursue there. I'm going to go around the panel still, though, before I start going deeper into some of these tangents. How about Gareth? Also, kind of in that domain of respiratory disease, or actually beyond that now into other kinds of chronic disease. How are you seeing this as a potential impact?
Thanks for the question, Ivan. So I'd just like to first go back to actually one of the early points that you made about how humans are really the big driver now of climate change. And so my lab is focused on trying to understand how our fat cells grow and develop. And we don't really think necessarily about the impacts of climate change on this, but like I said, with what you said, even in our lab where we do really basic research, fundamental research, looking at cells, working with cells and animals, now we have to make conscious decisions even of how we order supplies because everything is wrapped in plastic. We are always contributing. It's quite actually surprising and scary actually how much plastic waste that we produce that we can't always recycle. But with regards to obesity and other chronic diseases, what's very interesting is that while we don't necessarily think of obesity and climate change being linked, we know that if you think of the traditional causes of obesity, which would be increased food intake, a sedentary lifestyle, well, we can see that just by eating a lot of foods that require, corn and just a lot of farming, all these types of activities build into greenhouse gas emissions. And even, with regards to a sedentary lifestyle, well, some individuals would then choose to take a car, drive their own vehicles. We're not at the stage now of everyone having an electric car. So, greenhouse gases are being made. The impact of this is actually quite dramatic in that there was actually a paper published maybe 2 years ago in the Lancet, which suggested this concept of a global syndemic, where we have greenhouse gases being generated in response to the lifestyle or the demands and drivers of obesity. And what do these greenhouse gases do? Well, then they lead to climate change, affecting other populations in the world, leading to malnutrition. And while we know that obesity is not as simple as the traditional idea of increased food consumption and a sedentary lifestyle, we know that our genetics can play into this. We know that there's a possibility of fetal programming. So whatever, let's say, a pregnant mother experiences can actually influence the growth and development of the offspring. And these types of insults in utero can have a lasting effect on children when they grow up and putting them at risk of developing obesity. So really, I think it's like a vicious cycle. within another vicious cycle. And clearly there has to be something, or we should try to do something to stop that cycle. So I'll pass it back to you, Ivan.
That's great. And what an interesting dimension to open up, especially in light of what John said about the need for solutions. And I have to say that we find that as well. You know, readers at the Globe and Mail, or I think for all media, are saying that they don't just want to hear the bad news, although they recognize why it's important to hear it, but they want to hear what are tractable pathways forward that might improve the situation. And here's an interesting one where trying to improve health may actually, for a large population, especially in the developed world, may actually also improve the problem we're talking about today. So it's kind of an interesting, intriguing possibility hinting at some of the solution there and behavioral change that'll be required. So from there, let's go to Noma, sort of more into the neurological domain and into the area of stroke. How about from your perspective, Noma, where does climate change pop up in your work and in your thinking?
Well, thanks, Ivan. I thought I would start answering this question with a bit of a narrative review of my past training and experiences. And it starts a couple of decades ago when I went to the Marshall Islands, to an island in Ebi, to teach for a year. And without me knowing this, but it turned out I came to understand that if some of you might remember this, but the Ebi and the Marshall Islands were an area where there was nuclear testing in the 50s. And so the nuclear hydrogen atom bomb was dropped there. And as a result, the people were moved from their natural island to this island where I went to teach for a year called Ebi. So what was originally an island inhabited by 10 to 13 families, it was just 1 mile long and half a mile wide. It became and needed to be inhabited by over 1,000 people just because of the displacement that was caused by humans, testing their nuclear bombs. Fast forward, and Gareth and I didn't talk beforehand, but medical school and reading about Barker's hypothesis and the nutritional effects of outcomes later on in life and how they can affect both ischemic heart disease and stroke. And that brings me to where I am today. So my area of research is childhood stroke and trying to understand the risks and predictors of outcome in children who have had ischemic stroke worldwide. And it's really clear that there is an intersectionality between climate change as well as issues of social justice. People who are not making the decisions around where to drop the bombs, who are not emitting the most carbon, are the ones who typically suffer the most. They're the ones who are displaced. They are typically the migrants. They are typically the ones who have more issues with food security and accessing, all that is needed to develop appropriately. And it's been clear now, there's been a number of large population-based studies showing that association between prematurity, birth rate, early nutrition, and brain injury, both in early childhood, but in young adults. And what many people may not be aware of is that stroke, in particular ischemic stroke, is actually increasing and rising in incidence, both in children, but in young adults, as well as in young adults, unlike stroke incidence in those over 65. And the reasons are not clear. They're not the same as the reasons for, adult stroke risk. And so these environmental factors that have already been mentioned are likely playing a significant effect on these outcomes and how these children do. And so, it hasn't been studied well enough within these populations, but it's certainly an area for study. And within my program, we're beginning to look at this and, think that one of the mechanisms of injury for both the brain as well as the heart, but I focus on the brain, is vascular endothelial dysfunction, which are the sort of small vessels throughout the body. So we're seeing it, we're beginning to acknowledge it in a way, but it's always been there. And science in some sense is catching up with things that have been around us and trying to understand better how to do better.
Interesting. Again, lots of interesting threads to follow there. And I'm pleased that you mentioned social justice. And I think there are some interesting questions to be asked about, you know, what the trend of climate change may do to the existing healthcare inequities that we see, you know, across our country, but also globally. Let's also now go to Steve Shearer. So Steve, now, of course, known for his work in genomics and now acting head of research or director of research at Sick Kids Hospital. So I think with kind of a broader perspective there as well. Sorry, currently chief of research. What does that mean for you, Steve, when you're kind of either in the scope of your own work, you know, which is really sort of often dealing with maybe some of the underlying drivers of disease, but also when you kind of look at the agenda for the entire institution?
Well, I actually think that the biggest areas of impact of climate change on health are going to be in areas we haven't even thought of yet. So that's a way of dodging your question a little bit, but I actually think it's true, because if you look what happened just with the pandemic we're in currently now, the COVID-19, of course, there's been all kinds of direct impact of those people who have been infected by the virus. But in fact, probably the greatest impact across all of society has been beyond the physical impact, but the mental health impact. So at the hospital, for example, we have more admissions coming into sick kids with mental health issues that are probably pandemic related compared to those affected by the virus itself. So I think when we think about mass changes in the environment coming from climate change, you have to divide it into the immediate term or short-term impact and then the longer term. So that's the way how I would package things. And as many of you know, the Canadian government has announced many different granting opportunities in this area of climate change on health. So many of our scientists are thinking about how to package their ideas to study this issue. You heard some great examples of people who are already doing this. But I think a huge change will be that many of our healthcare researchers will start to actually study this question. And in fact, if you look back at COVID, probably 20 to 25% of our investigators who did not study any aspect of virology or immunology or health-related impacts were doing COVID-related research. So I think you're going to see a lot more scientists moving into this area. And I think that's really relevant to the topic of the funding of the Banting Research Foundation. It always has been most important, but I think even more so now as we go into the future is that our system trains scientists or biologists, people who have a broad understanding of the sciences, qualitative and quantitative sciences, a scientist is someone who can tackle a problem, bring solutions to a problem. So when the impacts of the climate change kind of hit us, we need to have the scientists prepared to move quickly to solve those problems. And instead of training specialists, I think this is really what Banting Research does, is it trains young investigators who are very broad in their disciplinary training. And I just would raise one example. When I was an undergraduate student, my first summer student job was studying viruses and how they infected plants, actually. Scraping the plant seeds and coating them with virus to see what lesions grew, what lesions didn't grow. And then I went through probably 30 years of training and research as a genome scientist. And then in the last 2 years, we're sequencing genomes of patients and viruses that cause this pandemic we're all in right now. So my training as a student came back to help me 30 years later. So anyways, I kind of dodged your question. I think that the main thing is that we don't know what's going to change. And if you think in the long term, I won't go too long, but certainly climate change will have a major impact on our genetics. This is how natural selection plays out. There changes, adaptation, and then the species moves forward. But that's on the very, very long term. So we'll see. I think we heard some good examples of the immediate impacts. Genes and environment, things like supply chain, mental health, emerging issues. mass migrations, I think, will be a major issue, and how that impacts new populations, new genetics coming into health systems. So I'll just stop there.
Those are terrific points, you know, and even just to take it to the overarching extreme. I mean, as you know, Steve, we're a species that was genetically shaped by the realities of an ice age, and not necessarily just, you know, the part of the population that was right near the ice age, or right near the glaciers, but you know, an ice age is a global event, and that's where the human species arose, and we seem to be turning the dial on the planet in a way that you know, maybe Earth has been here before, but humans have not.
Well,
So
just add that this will also, it already is, we've seen in the last few years, it's forcing our species to move off the planet.
Yeah.
So maybe that will be the ultimate impact.
Yeah, interesting. But your other remarks, I think, are a perfect setup for John too, because, you know, when the questions are so diverse and so interdisciplinary, and there's so much need for research, and kind of in a hurry, because we're seeing the pace of change increasing. How do we make that research count? And also, how do you set up researchers on a path where you know, this is where this differs from COVID, I think, is, you know, we're not looking to a horizon of a year or two, or maybe a few more than that, but thinking about the horizon of the entire century, and wanting to make sure that research careers are well positioned to address problems across the long term. What do you think, John? How do we go about this to make the best use of limited resources and time?
Well, great. Thanks for the question. I'm glad you didn't ask for the impact on my own research of climate change and health impacts, because, you know, quantum coherent control doesn't have a lot to say about climate change. Look, yeah, not yet. It may. Look, we're in the business, as I said in my opening remarks, of promoting partnerships. And you know, when I was a young assistant professor, I was told by a senior researcher who was trying to calm me down that, you know, asking questions is the important thing, and the answers, you know, might be non-existent, but it's asking questions. MyTax moves beyond that into actually providing answers. And I think that's key to what we're talking about here is we need to move to solutions. And MyTax works across all disciplines. We go all the way from, in fact, one of our recent Innovation Award winners was a medieval historian. We work across all disciplines, including, of course, health disciplines, to find solutions. And one trivial example, but important, is in a recent postdoctoral competition that we had in Elevate, so-called Elevate postdoctoral fellowships, 2-year fellowships. These were thematically based, and one of the themes was, of course, clean technology, a way of hopefully providing at least a partial technological solution to climate change. But they also was quantum, it was artificial intelligence, it was you know, what you'd expect it to be based on government priorities. More than half the applications came in clean technology. This is a growing area, and MyTax is happy to support it. But beyond that, you know, we're working with coastal and indigenous communities. We're, you know, doing language revitalization, but also impact, environmental impact of shipping, marine shipping on coastal coastal First Nations communities. We have now, because of an expanded federal mandate, and by the way, we're doing tens of thousands of internships per year. So we support thousands of research projects across all disciplines. Our expanded federal mandate now allows us to work with municipalities. And so you think about climate change, people live in cities. We need mitigation and adaptation of urban design for climate change. We can now do that as a result of the federal government, I said, expanding our mandate. And so that's the solutions part of it. But getting to training and picking up on what Stephen just said, you know, we need people trained with multidisciplinary approach, obviously steeped in disciplines, but with multidisciplinary approach. But more important, people who can work across disciplines, people who understand how to work in teams, people who understand how to communicate, how to work with industry, how to work with non-academic partners, not-for-profits. And that's basically what we do, because all of our research is based on partnerships. So it's academic research, absolutely, but academic research that connects to societal problems and really tries to find solutions to societal problems. And I think that's really important, basic science is incredibly important. Quantum coherent control is not something with obvious societal applications. And so I love basic science more than anybody else. We were talking about James Webb Telescope earlier before we started. This is fabulous, but we need to also translate and you know, to use health research jargon, translational research is also incredibly important. We need to get things, you know, bench to bedside, all of the other phrases that people use, but it's important to take advantage of the fabulous academic science that gets generated and social science and humanities in Canadian academic institutions and figure out how to apply them to solving societal problems. And the climate crisis is the biggest societal problem we have now.
Excellent. Thank you very much. And thanks again to all of the panelists for tackling different aspects of this question. I have a couple of follow-ups, but then I would really like to also turn it. We've got at least one question from the audience, but I would encourage everyone to pop in more questions. A lot of interesting points have been raised here, and I think there's room to try to push our panelists a little bit for more information and more detail. I would like to follow up in particular, although I'm sure everyone has some thoughts on this, but in particular with Jeremy, with Gareth and Noma, and pick up on a point that Noma made in particular about the social justice dimension to this. And this is both, and I think there's a dimension both internal to Canada, but also globally as well. I mean, the three of you work in areas that are major pillars of sort of, you know, disease response and challenge, you know, talking about stroke, talking about obesity and respiratory illness. All of these, you know, these things vary in population. They vary according to, among other things, according to where and how people live, and also what access to services they have. And we know there are socioeconomic dimensions to all of these things. So if climate change becomes an exacerbator of some of these healthcare inequities, you know, because of these differences in what people have access to, in where they live, under what circumstances they live. If I could ask the three of you what you are anticipating in your areas, how that might affect the populations that you study. If maybe we could start with Noma, but I'd also love to hear from Jeremy and Gareth.
Well, I think that the end result are the diseases that they're studying, they're an increase in their incidence per se. So from my point of view, within the brain, we include within the spectrum of ischemic brain injury, cognitive injury. So, you know, and along with the cognitive injury are the sort of disorders associated with executive function. So behaviors, learning, all impacted. And then that you have the impact on the child, the family, but then there are really far-reaching consequences for society too. And then when it comes to stroke, we are seeing an increase in the incidence of stroke. And like I said, the question is why? And I'm certain that a number of these factors are actually feeding into this. We actually just completed a study with a master's candidate, which has shown that outcomes post-stroke over the sort of last 3 census years have reduced, become worse than expected. And we thought that while we're doing more things, we're much more sort of technologically savvy, we have more research, we're faster at what we do, surely our outcomes should be becoming better, but they're not. And so the questions are why. And I think that what's really important for all of us to think and to acknowledge is that we really, there is no real I or me only. Whatever happens to somebody else or me has impacts beyond the the one person into society. So, you know, reversing, stopping actually, you know, these things getting worse and reversing the impact of climate change is an imperative. And I mean, I know we all know that, but certainly within my area, we can see impacts already, although we're not really calling it yet in very clear terms. We need to do that through our publications and knowledge translation so that the public are aware and so that our political representatives are also there, so that there's a real desire and energy to actually make the changes at a political level that need to be made.
Interesting. And, while we're talking about that, another side effect of climate change that perhaps, especially for Canada, which, has a large immigrant population and going forward will, almost certainly be welcoming people from around the world who are facing some of the effects. And some of that may include conflict and political outcomes from climate change elsewhere in the world, which has a huge cognitive and stress load, and that's going to sort of be a thread in our population as well to think about going forward. Let me also talk to Jeremy as well. Just I'm interested in what you're thinking in terms of forecasting the future. Obviously, a lot more forest fire smoke, very, very likely. But what does that mean in terms of what we should expect and how it might affect people differently?
So when you asked that question, I started thinking like, okay, well, I'm going to try to find what I'm going to forecast as like a solution. So to kind of use John's sort of framing. So not necessarily how bad it might get, but like what kind of solutions are going to come forward. And I think actually, so I'm not a clinician, but I have a bunch of clinical colleagues who are respirologists and tend to do outpatient clinics a lot of the time. And that was significantly impacted by COVID. It has been significantly impacted by COVID. Now, one could think of that entirely negatively, but the virtual care models that had to get up and running, to protect those patients and secure, private, and all the other things considered, really demonstrated that there's a new way to roll out, looking after those individuals that may be impacted by, climate change and may have existing conditions, but just can't seek treatment because they happen to be away from those centers. So actually, like a future, yes, there's going to be those problems, but I think the now has shown that, look, us having this virtual meeting right now, this now has shown that the technologies are there to roll out sort of strategies to manage patients that what may be healthy individuals, but also people that have pre-existing respiratory conditions. And I think that also works with industry, coming back to John's point about partnerships and even maybe some commercialization strategies there. I can say that our institute, the Firestone Institute for Respiratory Health at McMaster University, has partnered with multiple digital health companies trying to bring remote patient access, different tools to users that are user-friendly, that are equitable, that are even translated to use certain language that certain populations may use. So I think there's opportunity there that, I think there's like sort of a crisis. No, there's an opportunity in every crisis. And I think that's where we're finding ourselves with respiratory medicine. And hopefully in the future, we don't just go back to the status quo, but we actually begin rolling these out to underserviced populations or populations at risk. And we've got the proof of concept right now with the current environment we're in.
Interesting. Thank you for that. And Gareth, just to circle over to you, as you pointed out, obesity is interesting. It has this sort of interesting dual role in addition to potentially being exacerbated by climate change. It's a symptom, as well, or part of the symptom of the way we're choosing to use the planet. But it's also a comorbidity. It's something that comes up in connection with other diseases. And even as Kate was saying, there's so many pathways on which climate change can have an impact on human health. What happens when you add obesity to that mix, and does that then make the kind of work you're doing, how does that make it more urgent or change your focus?
Yeah, so obesity itself is a well-established risk factor for other chronic diseases like diabetes, cardiovascular diseases, and even some forms of cancer. And as I mentioned earlier, that there is a link between the type of food that we eat and the weight gain. One can imagine that with climate change, we've seen this actually in the summer. where we had droughts here in Quebec. Some of the produce that we normally get, was unavailable. And so that resulted in food prices just increasing astronomically. So one can imagine, like, as you pointed out, that there is a socioeconomic influence of, on obesity. And so this will just really exacerbate the prevalence of obesity in populations that cannot have, let's say, access to, high quality foods. We may have, individuals may have to choose to go towards very processed, calorically rich foods that only make things worse, right? So there's always unfortunately, it's the impact of obesity is very long lasting, and why, it's widespread.
Right. So, and, kind of pointing out the work that needs to be done to perhaps organize where we need to go. I have been looking at a couple of questions here from the audience. More are coming. So I'm going to point some of those questions to you, Kate. The two are related here from David Sadler. Climate change is such a broad subject, David points out. Who's in charge of the detection, measurement, tracking agenda? And actually, this dovetails with something I meant to ask you, which is where you think the gaps are, the data gaps that would help move research along in this area. David also asks, if there's a climate change 101 graphic for amateurs to better understand the cause and effect hierarchy, almost like the equivalent of a food chain description. But if we sort of focus on the gaps, and who's in charge of the tracking, where do we need data and how do we keep track of it, which presumably would then help guide what's needed?
Yeah, those are great and interrelated questions, and I'll try to answer each of them briefly. In terms of the tracking, I think the answer is right, that there's no one sort of global entity that's solely responsible for tracking either sort of the current state or sort of future projections of climate, or the impacts, including the impacts on human health. But the Intergovernmental Panel on Climate Change, I think, is one of the more helpful resources here. In part because they do both, right? So this is sort of an international gathering of scientists who comes together it's been about 7 years now, I think that's right, but roughly every 5 to 7 years, to assess first sort of what we know about the state of the climate and what we expect for the future. So that was the Working Group 1 report that Ivan was mentioning. But also to sort of say what we know at a particular point in time, where we are in terms of societal impacts. That's Working Group 2, which is coming out in just about a month. But there are also, more local, right? So national or sort of local entities that sort of track climate indicators as well. One resource in Canada is the 2019 Canada's Changing Climate Report. There are national reports other places as well. So I guess that's a longer way of saying there's sort of multiple resources here. In terms of gaps, man, hard to know where to start. I would say, a few places that this is something I've been doing for about 10 years, and I would say a few of the places where we have less research. I would say one is sort of the longer term implications of sort of disruptions related to climate change. So we are pretty good at sort of saying what a heat wave is going to do to people's health during the heat wave and in the days immediately after the heat wave. We're pretty good at saying what a wildfire might do in the immediate term. And I think one place that we'll see an increasing amount of research is what are the longer term sort of health impacts of these sort of disruptive extreme weather events that we're seeing more and more of the result of climate change. I would also say that the mental health impacts are an area that have received relatively less attention to date. And then finally, this is to me, this area I think is critically important. But I think we've been talking today a lot about solutions. And so to me, an area that I would like to see more research is not just, I've told you all about how some of my work involves sort of characterizing how bad the problem is going to be. But I think there's a lot more that can be done in terms of understanding solutions and not just new solutions, but what public health measures do we already have we already started implementing today that might be effective in responding to the health impacts of climate change? So in the area of heat waves, right? Like there are things that we do during heat waves to try to help people keep safe, but what do we know about what works the best and what could be deployed in sort of like what's the best state of the evidence in responding to a heat wave, and is an example there. So those are a few examples of places where I think we spent less time on them to date, but I see them sort of as growth areas. Oh, and I do have a graphic. I can put it in the chat if you would like me to. Yeah.
I think that would be useful. I think,
sure.
We have a bit of time. Speaking of time, I just want to turn to Daniel and see where we're at. We're just hitting 4 o'clock mark, and I know there are other things on the agenda. We still have some more questions. Do we have time for
I think if we took one more question and then we had some closing comments, I think we'll be right on time.
Sure. I'm gonna go to Shannon Grauer's question, which I think is a tough one for everybody. And I'll just paraphrase it to shorten it a bit. Just for multiple reasons, it feels at present that the world's not well placed to focus urgently on climate change. I think that's a fair assertion. Is part of the solution more regulatory requirements to force changes? How do we deal with this topic? How can these be enforced? These are very interesting and timely questions because I think with COVID, we're really seeing the limits of collective public action for the common good just by explaining to people why they have to do certain things. That seems to only take you so far. Now, I realize it's easy to say, well, these aren't really healthcare questions. These are public policy questions. These are communication questions. But nevertheless, no one else seems to have really good answers for this. So I'm going to call on you and your expertise as well, for some intuition. And, especially because we're talking about areas where people who study human health also have tried hard to get messages across to individuals about what they should be doing for their own good, and may have some insights on how to turn that conversation not only to our own good but also to our collective good. Why don't I start with Steve on this one and see just what thoughts you have. I kind of ambushed you there, Steve, but how do we get this? How do we get people to do what they need to do to make it better?
I think the solution is in our children. If you ask, my kids, I have 2 kids who are in high school, and climate change is top of mind for them, and they see it from the long-term perspective. So I think we're almost there. In fact, there could be some positive outcomes of climate change too. Of course, some people who figure it out may actually thrive. That's one way to look at it. That's not to say it's not an important issue, but more relevant to your comment is that I think a lot about natural evolution and cultural evolution. I used to teach my students a few years ago, as the human species, we evolved that we've essentially removed natural selective pressures from most of our daily lives. It's not true anymore. I actually have to take that back. But I think the biggest impact actually will be in cultural evolution. We've changed the opinions. The biggest mind change or game changer is actually climate change. So perhaps this will be, the event that kind of turns the clock backwards and gets us thinking as a species to take our lives seriously. And if you can do that, then you start to think about the food you should eat and the food you shouldn't eat, and the toxins you expose yourself to. Everything maps back to the changes your DNA accumulates, the behavioral decisions, everything. So in a way, if we can kind of put the right spin on this, it might be a good outcome for our species. I'll just leave it with that comment.
It's a great comment. I reflect on, I've been at the Globe and Mail, 9 years now. It's kind of has gone by very quickly. I was with other publications before that. And, when I talk to my own kids or to others about how, it seems like nothing ever changes. There's this constant, these international negotiations happen and everything seems so uncertain and inconclusive. I could at least say from the point of view of how the mainstream media pays attention to this, it really has been a remarkable evolution. Climate change and environmental, what would be called environmental issues, have moved from a niche part of the reporting, that would sort of be sandwiched between politics and business off to the side, to now being central to everything that we talk about, and front page, often front page news, but more importantly, integrated into everything else. So, I can see that change even in my own work. Science journalists used to talk about how do we make editors understand that this is important. Nobody has that conversation anymore in science journalism. Everyone realizes this is really important stuff. So maybe that's a hopeful sign. I'd love to sort of go through the panel again, just very quickly, for any parting thoughts on where we go from here, or just leave us with something to think about. Why don't I sort of go in reverse? Well, we've just heard from Steve, so why don't I go back to John, and then I'll kind of go in reverse order, and we'll finish with Kate. And any final thoughts, John?
Yeah, I think just it's been a great discussion, and hard to sort of wrap it all up, but kind of related to your last question. I think we need a broad look and a truly interdisciplinary look. We've heard about, climate impact on politics, on migration, on health. The one thing that we need to do is understand that this is a problem with many, many facets. It's not an easy problem to solve. We need to solve it in a hurry. And I think that's one of the difficulties, is that human beings have a very hard time going beyond the here and now. We've seen a great pandemic response. Even there's a lot of confusion about what measures should be taken. But climate change is something we can ignore because, it's not so bad. It's going to happen sometime in the future. But I think thinking about the sociology, the politics, the economics of climate change, in addition to the technical aspects, the health aspects, is going to be really important. Looking for solutions, reaching across disciplines, reaching, as I said earlier, between the academy and society. This is all going to be really important. But I think, we need to cast our mind as much to the cultural aspects, getting to cultural evolution versus biological evolution. We need to evolve pretty rapidly culturally, or else it's going to be too late by the time we take this seriously. We've only got another decade or less to actually make tangible progress on this. And if I was a betting person, I would give it at best 50-50 odds now. But I think, there's a lot of work to be done, but it's work across all disciplines. Everybody has to weigh in on this one.
Got it. And that ratchets up the urgency, certainly. Noma, thoughts on your end? What would you like?
I agree with everything that's been said to date, and just to encourage each other to think in the terms of I am because you are, and I am because we are. So this Zulu word of Ubuntu, which, if we can spread that among us, where we really understand the sort of community that we live in, that it is truly a global village, and that urgency matters to all of us, then I think we can be hopeful.
Wonderful. That's a great thought. And Gareth, when I think about what you said at the beginning, how these problems are interrelated, it just reminds me of some of what's come out of the negotiations that are parallel to climate change, which is biodiversity, the habitat that we need for nature, and so on. And that very quickly gets you into discussing the land that's used for agriculture, other aspects of human activity. And soon, you don't have to report in that area very long before you realize that, gosh, you really can't solve any one of those problems unless you're solving all of them at once. And I think that perhaps some of our human health problems are wrapped into that as well. I'm wondering what any closing thoughts on your end about how we could accomplish all of that together.
Yeah, I totally agree with everything that's been said. And I too am a firm believer that really the future is with our kids. And, I live through them. They teach me. My own kids teach me about climate change, a lot about climate change, and inspire me. And we really just need to, if they have interest, we need to support them, right? Because ultimately they are the ones who are going to be living on this earth after us. So, if they have an urgency and want to do things, we need to encourage and support them to continue and to really push, I think.
Got it. Great thought. Daniel, what do you think? What do you say?
Are you passing it back to me now?
Sorry, I meant Jeremy. Sorry about that. My apologies.
No, I actually, similar to Gareth, Gareth's a friend of mine, and I've learned all of my parenting lessons from him, and I have two that are younger than his, and I see hope in them. They're inspiring. They figure out things without you telling them, and they do it in a way you wouldn't do it. And I have students like that are so impressive that they come up with solutions to the problems that are like, well, I wouldn't do it that way, but that's pretty creative. And I think Gareth's saying you need to support them and you need to give them the opportunities. I mean, I think that's what the Banting Foundation is also doing, is it is supporting those people that, have these creative ideas and they're at that point in their career where they're really launching. And I think, all along that continuum from your little toddler that's crawling around and doing things that they shouldn't be doing, to the undergraduate students, to postdocs, to early faculty. I mean, that continuum needs to be there, it needs to be intact. And I'm optimistic because if I'm not optimistic, then the flip side of it is bad. So I'm going to stick with optimism.
Really interesting. And this, there's kind of a metaphor buried in there for the entire species, for all of human civilization, trying to raise ourselves up on this planet without any parenting, and make it work and take responsibility for the whole world. Kate, we have to finish with you as an epidemiologist. You and your colleagues are the ones with the crystal ball often. What does that tell you about where we're going?
Yeah, I thought I might just, there's been so many great points made on the panel, and I agree with so many of them. And I think I just wanted to say that the one that's really sticking to me actually was something John said about sort of the important resource that we don't really have right now is time. Time is a resource. And I felt that driven home for me in a very real way this summer when I found myself needing to leave my own home in the middle of the heat wave and trying to go and do my work, which is on climate change from a cooling center, because I no longer felt safe in my own home. And I just want to, I'm so glad to see so many of us here together today to talk about this issue, because the time is so critical. I guess the other thing I'll say is really just to agree with Gareth and with Jeremy about drawing hope from folks who are going to come behind us. I have the great privilege of teaching sort of environmental health generally and sort of the links between climate and health specifically to undergraduates at UBC. And they're really inspiring and impressive. And so I sort of share that sentiment of drawing hope about people who are going to take up the mantle even after us. I think I'll close there on a more optimistic note.
Excellent. I think that's a great way to end. And I know there's more on the agenda, so I will turn it back to Daniel. Thank you very much, though, to the whole panel for all of your contributions to this conversation and for your thoughts.
Thank you so much, Ivan. That was fantastic. Thank you, Steve, John, Gareth, Nomazulu, Kate, and Jeremy. I never would have predicted that we'd end up on such a hopeful note, but I absolutely love that. That is fantastic. Such an enlightening panel, lots to unpack. We could have kept this conversation going for about 6 more hours, which I really love. So we will have to continue this conversation at some point. We are going to change gears now. We do need to hear about some of